Hey, everybody, I want to talk to you about the power of fiber to reduce your weight and your blood sugar levels. I see so many patients, as the statistics show, where 75% of the American population are overweight, and of course, diabetes is skyrocketing. Now, there's many factors involved in lowering your weight as well as your blood sugar levels, but today I want to talk about the power of fiber because when you look at the research, you're finding this very simple technique of using the right type of fiber, the right doses can make a pronounced effect on your weight loss and dropping your blood sugar levels, as well as improving your appetite. So let's get into this very important information that most people need to improve their weight and their blood sugar levels. First of all, what is fiber? Well, fiber is basically something you find in plant foods, which is indigestible. So you eat it, and most people know it helps with bowel movement, helps with regularity because it can't be broken down in our digestive tract. It has another important role, and that is it is a fuel supply to the good microbes, the microbiome in our gut. So it feeds the healthy bacteria, which have many effects in the body. Helps you to feel full, helps with your mood, helps with your metabolism, helps with your blood sugar levels. And so we know this to be a fact in medicine. Now, there's two types of main fiber you should be aware of. One, soluble fiber. And this is a type of fiber that dissolves in water to form a gel-like substance in your digestive tract. And so this gel slows down digestion. And when it does, it leads to prolonged satiety. That means you feel full longer. It decreases your appetite, so you're less likely to overeat. It reduces the glycemic index of foods you're eating, so because it helps to moderate blood sugar spikes after meals. So examples of soluble fiber would be the skin you have in apples, pears, you get in citrus fruits, carrots, broccoli, peas, cucumbers, celery, and then the most recognizable form of soluble fiber is oat bran. Now, the second type is insoluble fiber, and this is the type that does not dissolve in water and acts as a bulk agent, and as I mentioned before, helps with bowel regularity. And you find the insoluble fiber in cereal bran, whole grains, legumes, and dried fruit. But here's the issue when it comes to fiber, just in general. Here's an amazing statistic. 90% of women and 97% of men in US do not consume the recommended daily amount of fiber. And so this is going to lead to, again, problems with weight, not feeling full, overeating, not regulating your blood sugar levels. And of course, there's other risks. We know that people who consume higher fiber diets have less types of cancers and other health conditions. So very, very important. When you look at the amount of fiber that's recommended for adults over the age of 31, they should be getting 31 grams of fiber a day, and for females, 25 grams. And you look at studies, most people in America get about half the amount or 50% the amount of the fiber that they should be getting in their diet. So we have to work on this because there's no way we can be healthy unless we get enough fiber. And in the American diet, with our refined flours, our lack of fiber-rich foods, because we're not eating whole foods, this has a significant impact on insulin resistance, appetite control, and weight management. So let's go over some strategies of how to use fiber properly. Well, one simple technique, and one I often recommend to patients, is to consume fiber-rich foods or fiber supplements at the beginning of meals. Usually here in America, people eat their vegetables in the middle of their meal or at the end of the meal. They eat their carbs and their proteins and their fats first. We need to reverse that because when you eat the fiber first, it has a powerful effect. It improves satiation and satiety. So fiber plays a critical role in regulating your appetite. What is satiation? Well, that's the feeling of fullness during a meal, and satiety is the reduction of hunger after a meal. So both are important. We need to feel full during a meal and after a meal, and fiber helps you to accomplish that. And so whether it's from food or supplements, both help satiation and satiety. Well, I hope you're enjoying the video. If you're looking for quality supplements, go to my website, drstengler.com, and there you can see the nutritional supplements I've been using with my patients for many decades. They involve a lot of scientific research. Many of them I've created myself. So again, thank you for watching the video, and check out my supplement store at drstengler.com. Let's talk about the viscous fibers because they're very key in terms of helping regulating your appetite. So certain viscous fibers like pectin, psyllium, and guar gum are very effective. As I mentioned before, they form a gel in your stomach and intestines, slowing down how quickly food moves throughout your digestive system. So this prolongs the feeling of fullness, but also helps to regulate glucose absorption. This prevents blood sugar spikes and insulin spikes, helping that insulin resistance. And as I mentioned before, these types of fibers are fermented by your gut microflora, and they produce beneficial short-chain fatty acids like butyrate, for example, and other ones. And they help in burning fat for energy. They regulate fat storage and breakdown, and they improve insulin sensitivity. So fiber, again, feeding these good short-chain fatty acids, which affect your metabolism metabolism. Research shows an inverse relationship between fiber intake and obesity risk. Simply put, people who eat more fiber tend to be leaner. Increased dietary fiber intake also has been shown to promote weight loss in adults who are overweight or obese, especially when combined with calorie-restricted diets. So let's look at a couple interesting studies. One Japanese study highlighted the immediate impact of fiber on blood sugar. In this study, researchers had young, healthy women consume a breakfast meal, either eating vegetables first or carbohydrates first. And you can pretty much assume what they're going to find. They found that consuming vegetables first significantly lowered blood glucose and insulin levels, and this was regardless of how quickly the women ate their meal. So this simple change can make a big difference in managing your post-meal blood sugar levels. Let's talk about another study, a study done pretty recently in 2024. And in this study, they investigated a high-fiber diet compared to the standard diet for American females between the ages of 40 to 64. And so the 300 participants were classified as being obese, and they were randomly divided into two groups. You had one group following a normal American diet, another one following a high-fiber diet. And this was conducted for 8 weeks. All the participants were living in a hospital setting, and their diets were prepared by the hospital. Both groups consumed 1,800 calories a day. Those in the high-fiber diet group consumed 35 to 70 grams of fiber daily, so quite a high amount. And they consumed the fiber through vegetables and fruits. All the participants had their baseline measurements, and then twice weekly, they had measurements of their weight, their waist circumference, and other markers. All participants in both groups walked 12,000 steps per day and had other simple cardio exercises. So here are the interesting results. They were that the high-fiber diet group lost a significant amount of weight as compared to the normal diet group. They lost about 16 pounds compared to about 2.5 pounds in that 8-week period of time. Also, the high-fiber group had an average waist circumference loss of 10.3 centimeters as compared to 6.4 centimeters for the normal diet group. Remember, the normal diet group was conducting the exercise every day, as they did in both groups. Moreover, body fat mass decreased by 4.1 kilograms for the high-fiber diet group. That's almost close to 10 pounds, compared to no change in the normal diet group. So these are pretty pronounced results in the two studies that are reviewed. So what should you do? Well, I recommend consuming vegetables like salads or other vegetables at the beginning of meals when you can. Now, if it's a certain type of meal where you're organized for that, you don't have the time, or you don't have that type of food with you, then simply take a fiber supplement. The most well-studied fiber supplements are psyllium, like psyllium seeds and husks, and then another one known as glucomannan, which is taken from the konjac herb. And the common dose for both of these, when you look at the research, which I have done, you take 5 grams with about 10 ounces of water twice daily. So you could take the fiber supplement, normally in powder form, before 2 meals a day. And so one thing you should know, it's important to increase your fiber intake slowly over a few weeks. Some people, they'll have digestive distress. They're not used to getting so much fiber, and they could get digestive upset. So just increase it slowly over a couple weeks, and your body will normally adjust to that. If you're having problems, you'll just have to cut back the amount of fiber that you can tolerate. Well, there you have it. Just getting the fiber in your diet, increasing the amount of fiber, mainly through vegetables, and then secondarily fruits, and using fiber supplements, you can make a pronounced effect both on your weight and your blood sugar levels. Well, I hope you like this, and you can look for other videos I've made on weight loss and blood sugar regulation.